Welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder. I am also the best-selling author of the books All Rise, The Sickle Cell Community versus the Medical Establishment, and A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. These days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. Hello again, guys. This is Dr. Simone here. Listen, I just wanted to drop a video today because I was thinking about how we are doing in terms of accessing the healthcare system during the pandemic. There's 7 things that I want to share with you guys. I don't know that everybody knows these things, and sometimes I take it for granted and I go, they already know that, I won't share that. But I'm learning more and more that the best thing to do is to put it out there, and if someone already knows it, great. But if there's someone that doesn't know it, it can help them. So I want to start with what's going on. So I am noticing that not only me, but several of my friends are sick and not wanting to access the healthcare system because we're afraid. I had to go get some imaging and I kept dragging my feet because I didn't want to go to the imaging center because you have to sit and wait for your turn. You have to fill out forms and all these things. And in the meantime, it's usually a room full of people. And, I'm just trying to limit my exposure. I am doing preventive things to boost my immune system and all of that. But why put myself in harm's way if I don't have to, right? So I have been trying my very best to kind of stay out. But, our bodies, our beautiful sickle cell thriving bodies, didn't get the memo that it's a pandemic. And so I found myself a couple of times, whether it got too cold or I stressed myself emotionally, which I'll tell you more about that later. I ended up in the hospital and with a sickle cell crisis in the middle of COVID season, right? They were like expanding floors and things like that because they were getting more COVID patients. And that's the last thing I want, is to be having to go to the hospital in the middle of a surge of COVID. But I was there, I double masked and everything, but I was not happy to be there, especially because of what was going on around me and because no one could come to see me, visit me. My husband had to drop me off at one point just because of the restrictions that they had. If he came to visit me, I was afraid for him. So then I was like, okay, don't come to visit me. So my one visitor that I had ended up being no visitors because I didn't want to put anybody in harm's way. And they even say if you have a visitor, it has to be the same visitor throughout. So it was really rigid. This is not the time to be in the hospital. There is like no emotional support of people being there with you or anything like that. So I just thought of, we need to think of, ways to just minimize contact, ways to stay away, and what we can do when we absolutely have to go, because sometimes we do have to go, right? So let me start first with preventive things that I'm doing, and just want to share some things with you. You all know that I grew up in South America, so my first line of defense is always holistic, right? So I do use my oil of oreganos, my olive leaf extracts, and things like that. One of the most recent discoveries that I've had is eucalyptus oil. I've used eucalyptus oil in the past, but I've used it for different things. And this time around, I'm realizing that eucalyptus oil is good for sinus infections. I'm sinus congested a lot, like season in, season out. But during the winter, I will tend to have a few episodes of sinus infections where I have to really be aggressive about getting it under control or end up having to be on antibiotic. I will try the natural antibiotics and then it will get out of control sometimes and I'll have to
do prescription antibiotics, which I hate because then you have to rebalance your body with probiotics and do all sorts of things to restabilize your system. But eucalyptus oil I'm using in I wear oxygen, so there's a humidifier. I'm putting some drops in the humidifier. I have a nebulizer system, and sometimes I will just let the nebulizer just blow the aerosolized spray in my area. I may not put on a mask, but I just want to inhale the eucalyptus oil. If you have a diffuser, which I have, I will put it in the diffuser, and that's where I usually used it. So I put in the diffuser. Eucalyptus oil is known for killing 90% of viruses, and so it's a great way to just kind of keep the microbes at bay in your little space. So things like that, preventive things that you know to do medically, please do. It should always be your first line of defense, and especially so now when you can't access the healthcare system as you please. The second thing that you can do is signing up for your patient portal. Like, every hospital has transitioned to electronic health records, and they give you access to those records. It may vary from state to state the amount of access that you have, but many people are offered a patient portal, and then you have access to your lab work, your imaging studies, and things like that. And you can also request things on the patient portal, like medication refills and having virtual visits from your doctor and things like that, making appointments for those kinds of things. And you should be utilizing and maximizing those telehealth virtual visits, because you can do that in the comfort of your own home. Now, there are some limitations, I know, because they can't examine you and those sorts of things, but to the extent that you can use that, please maximize that, so that you don't have to go out and be in an environment that might not be supportive of your immune system. The third thing I want to talk about is home health. And this depends on insurance, because I'm starting to realize that depending on your insurance, it may not always be available to you. I know for sure that if you have commercial insurance, so if you're working or if you're on your family's health insurance, then you have access to a lot of home health. I do believe you have it with Medicaid too in some states. It's just that it varies, and it's limited in certain states. But you can actually call your insurance and say, listen, it would be more beneficial for me to be treated at home versus being in the hospital. And I would rather get IV fluids at home if I were sick, or, pain medication if I were sick, through a home health agency. And they usually can give you a list of the home health agencies that are within network, and then you can call your doctor and ask them to fax an order for IV fluids, for blood draws, for pain meds, and all that sort of stuff to the home health agency, and they would send out someone. Now, one of the things that I do know has come up is access, like venous access. So I have a Metaport, and that makes it easier for them to access. If you have a PIC line or a Metaport, it makes it easier for them to access. It doesn't mean that they can't access you peripherally, but if you have been a hard stick, which most people are with sickle cell, then it becomes a challenge for them to be able to administer IV fluids and things like that at home. Not that they couldn't work with you and explore other options. And if there is any time to explore other options, this is the time. Like, if there is someone that can actually come and put in a line, like a PIC line, um, at home with home health, things like that. That would be great. And this is the time, especially when they don't want you to be in the hospital and they don't want to pay for a hospital bill. And you're saying, listen, I want to save you money and help myself. They're more liable to be open-minded about these options. So ask for them. Ask your doctor and your insurance who which home health agency they cover, and then just ask your doctor to send in a script and see what happens. Do this when you're well, not when you're sick, because when you're sick, you do not want to be start from scratch. All that would need to be in place before you have a crisis, so that when you are sick or if you need a blood draw, everything will be working like clockwork because you've already greased the wheel. So take advantage of home health, of lab draws that can be drawn at home, and IV fluids and pain medications that can be done at home. If you are going for a procedure like an imaging center, like I was talking about, I am learning that you can ask them when you arrive, you can go inside and immediately ask them, listen, I am high risk and I do not want to be in your waiting room. Most of them have adapted their waiting rooms to have social distancing and things like that. So there are less people in the waiting room. And some centers have even adapted a system where they take your phone number and allow you to wait in your car, and when the room is less crowded they will call you. So if that's not in place, ask them. Go to the desk and say, listen, I don't want to wait here. And this can be for even if you go to the emergency room. I don't want to wait in your waiting room because I am immune challenged. May I wait outside and may I give you my phone number? And when my turn comes up, can you just text me or call me, and I'll have my ringer on and I'll be waiting for your call. And oftentimes they're more than willing to do that because this everything is new, right? So they're just trying their best to work with you as much as they can. So ask for these services. And the other thing is, they're willing to do this because it protects them too. Less exposure to clients in general is protecting them as well. So they're motivated to cooperate and do it. Also, you can walk with gloves and wipes. These days, nobody even bats an eye at you if you like whip out your, Lysol wipes and start wiping chairs down. I remember I've been doing that for years, and people would look at me like I had a third eye. These days, no problem, right? So people are getting accustomed to the fact that people are extra cautious of things. And so if I wipe down the chair, or I wipe down, or I have gloves on, or I wipe down, the board that they give me, or I give them my ID and insurance card and I wipe that down and put it back in my purse, nobody bats an eye. So these are things that, you can do. Otherwise, if you didn't want to sit, you can just pace, you can just stand. You don't have to sit. I've gone to my pulmonary appointment where I was like number 2 and I realized I wasn't going to have to wait long. So I just, just paced around until it was my time, which was about 5 minutes wait, really. And then I was in. So just limiting, exposure. If you have to be admitted to the hospital, try asking. It doesn't always work, but try asking your hematologist to call the hospitalist that is on call. There are usually many different teams that service a hospital. And if you've been in the hospital before and you had a certain hospitalist that you felt like really paid attention to you, you could actually ask them for their card. They usually give it to you anyway, and request to be on their service the next time you were in the ER or being admitted. You can actually say which hospitalist service you would like to be on, which team you would like to be on, and they'll put you on it. It might not be the same doctor, but there's always someone on that team that will be on. And if they know the doctor that you're talking about, you can share with them, listen, I know Dr. So-and-so, he was really nice to me. If you have any questions about my care, you might want to call him, because I know he worked with me and he was very understanding, and he was very knowledgeable about my situation. So you could do that. That can work to your benefit, because there's a sense of patient history and continuity of care, right? So if your hematologist can do that, that's really wonderful. And I know that a lot of people are saying we don't even have that system, especially outside of the country. So I understand that, and I appreciate that you're in a different situation, and I hope that that changes for you in the future. But for anyone that does have that, I'm just reminding them that they can utilize that, and and not have to be in the emergency room for an extended period of time and with greater exposure. One of the things I'm trying to do is encourage our adults living with sickle cell disease to have advocates that would connect with them during a visit or a hospital stay, and maximizing the use of all of the social media platforms to be able to stay connected, because a lot of people feel lonely during those times, and especially during a hospitalization when you can't have visitors. So, what we're going to be doing is pairing people up, or people who want to be paired up, with a sickle cell advocate that we will train to be able to keep an eye on things for you when you're at your most vulnerable point, and kind of remind you of even things that you could do to improve the situation as you go. Because when you're sick, you're not thinking at your optimal, right? So there might be things that you could do to protect your health or improve your health access that you're not thinking of at the time. And so the use of all of these social media platforms, Zoom, Messenger that has the video option, FaceTime for those who have phones with FaceTime, all of those methods, just to be able to have a visitor, to have someone talking you through things, and or increase the possibility that you would have the best care during this time, especially because you're having to go in by yourself. And so that's a campaign that we've just started, and you'll probably see more videos on that later. But that's one way that you can access that healthcare and optimize it, is with keeping connected to the outside with people who are there to help you through the process. Number 7, stay away from things that are triggers. So, what are your triggers? Well, the weather is a trigger, so please bundle up, or just don't go out in extreme weather. Don't do things because your family or friends are doing it, or we're all going to go skiing, or we're all going to go snowboarding, when you know that that can put you at extra risk. Because when you go to the hospital, they'll be home just drinking hot chocolate and recuperating. But things like that can send you to the hospital. So try not to get pressured into doing things that your body is not capable of handling. And I also want to bring up just drama. Stress can trigger your sickle cell crisis. And if there's anything I learned this past year of 2020, is that I am an empath, and I can become really engaged very quickly as I sympathize with someone. But I can also be very brokenhearted when things go sideways, or someone responds really harshly to me, or something like that. And those kind of triggers are not good at a time like this, especially because a couple of times it landed me in the hospital, because my system was already emotionally stressed from all that was happening over the year, and not really realizing that my body was reacting to that and not processing it well, I ended up in the hospital. And that was an eye opener for me. That was like, okay, stop everything, shut everything down. Let me reevaluate what is happening and what I need to do to protect myself, because at the end of the day, I'm the only one in the hospital. And once you all know, once you trigger a crisis, anything could happen. You can get a stroke, you can get a heart attack, you can lose a limb because something sickled and blocked circulation. There's a lot to lose every time you have a crisis. So your best bet is to not trigger a crisis and stay away from drama. And you know that there's certain things, there's certain people, there's certain circles that tend to be more high drama. Stay away from those circles, stay away from those people, and realize that it's okay to say no. Your health is more important than their discontent. Okay, so try to protect your health as much as you can, especially when you know that the cost that you will pay is much higher than anything they will pay in any sort of situation. So that's it. That's all I have for you today. And if there are any things that you thought I missed, ways to protect yourself, please, please, please comment on the YouTube channel so that everyone can see it. I know I'm going to post these videos in different groups. Please don't just comment in your group, because not everybody is a part of that group. Comment on the YouTube channel so that everyone can see and appreciate if there is another thing that we can do to protect ourselves, that you can share, and it would be central and everyone can access it. Have a great week, you guys, and I will talk with you soon.
Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you benefited from this episode any at all, please like on the video, subscribe to the channel, and share the video with one other person as your good deed towards the sickle cell cause. Have a great day. If you would like to contact me to speak in your area, please don't hesitate to email me at drSimoneSays@gmail.com. If you are the one referring me, please let me know so that I could send you a nice thank you surprise.